Germany has reported 962 deaths from coronavirus in the past 24 hours, the country's highest daily toll since the start of the pandemic. This comes a week after Germany tightened lockdown measures in a bid to contain the spread of the virus during the holiday period. As in other countries hard hit by the second wave of infections, it's not just hospitals that are struggling to cope.
They've been working round the clock at Mason Crematorium. The coronavirus means they've had to deal with many more bodies this year. The sealed coffins have COVID-19 victims inside. With these safety precautions in place, it's nearly impossible to have direct contact with the dead. Crematoriums here in the state of Saxony are at maximum capacity. About half the coffins have a coronavirus sticker, highly infectious. The state premier is warning residents the next 10 weeks will be the most difficult. There will be a third wave. The question is how high it will be. And everyone who is dealing with this is worried about how much higher than the current peak it will climb. The number of new infections may at last be levelling out. But people in Meissen want answers from their leaders. They just can't agree. There are no clear rules. No one is going outside anymore. People are infecting their own families. Some people are following all the rules, and others are coming up with their own theories. They say there is no coronavirus. But every day there are more coffins in the crematorium containing the bodies of COVID-19 victims.
Let's bring in our political correspondent, Emmanuel Schaz. Emma, the coronavirus fatalities in Germany are continuing to rise despite strict lockdown measures. Do we know why?
Well, Terry, there's an increasingly diffuse transmission, which means more and more clusters and more of those happen in nursing and care homes, where you will find the most vulnerable people, the elderly, sick people. And also there's more infections happening in community facilities, in religious events, in any places where there's contact between people. And added to that, one key point is really trying to curb infections. Trying to curb those infections is really to trace the infection chain. And in most cases, this is no longer possible. There's nearly 25,000 new infections today, 962 deaths. If you look at the 7 days incidence rate, it has been skyrocketing, nearly 200 cases per 100,000 inhabitants. That's 4 times higher than what is already a critical threshold. So that's fair to say that the situation is not under control at the moment.
Now, the head of Germany's Infectious Diseases Institute says that if case numbers keep rising, even stricter lockdown measures may become necessary. What sort of measures are we talking about?
Well, the goal is and has always been to prevent the spread of the virus by reducing contacts. Hence, social interactions would be hit. Lothar Wieler, the head of Institute, issued a stark warning. He said to not travel, and many scientists fear the effects that Christmas will have on the pandemic as people travel to meet with their families. And some states have already introduced new rules. In Bavaria, for example, all travelers returning from high-risk areas will have to undergo a coronavirus test. And in Baden-Württemberg, there will be a quarantine requirement for people coming from neighboring France and Switzerland. There's also a huge debate here in Germany on whether or not churches, well, they should cancel Christmas services, something that has been met with opposition from some state premiers, for example, in North Rhine-Westphalia.
Now, Germany, like much of Europe, is expected to start rolling out its vaccination program on December 27th. That's just 4 days from now. Is everything in place to assure a smooth start?
Well, first, there will be around 150,000 doses of the BioNTech Pfizer vaccine that are due to be delivered on December 26th. And the first vaccinations should take place in elderly care homes the following day. And then further doses will be due later in the week. And the Health Ministry said that there's around 3 to 4 million doses that could be given out in January only, and 13 million, up to 13 million by the end of March. They will be administered in care and nursing homes first. Then there will be a special vaccine vaccination centers that have been set up already all over the country, and vaccines will first go to the most vulnerable, and that includes the elderly and medical personnel, and then the general population. And Germany has ordered the BioNTech Pfizer vaccine, but also the Moderna vaccine, which is still awaiting approval from EU regulators.
Emma, thanks for bringing us up to date there. DW's political correspondent Emmanuel Charles. While the coronavirus has spread throughout Germany, it's affected some parts of the country, of course, worse than others. The first hotspot emerged back in March in the town of Heinsberg in the far west of the country. That outbreak was attributed to regional carnival celebrations. As 2020 draws to a close, we look at the impact the pandemic has had on the small community there.
As a priest, Markus Bruns has guided many people from Heinsberg through this difficult year.
Ein sehr anstrengendes Jahr.
A very exhausting year. It took a lot of strength. You can already see how it is weighing on people. I think we've really been burdened by all the economic consequences and repercussions, by the whole situation. And people have fallen ill and died, which is the worst kind of burden. The situation is not easy for him either. Heinsberg is small. Almost everyone knows everyone. Bruns had to bury people he knew who had died of corona. The experience when corona hit us back in February and the numbers began to rise in the Heinsberg district, all the numbers very quickly became names and faces. So you know the families, you know the people who are affected. That was very challenging. In February, Heinsberg was confronted with one of the first major outbreaks of the coronavirus in Germany. An infected couple had attended a carnival party. Soon after, Heinsberg became the epicenter of the pandemic. For many residents, this was a very difficult time. One was really very affected, especially since the first infected people were my own acquaintances, and we experienced at first hand that the virus can have drastic effects. Among our relatives and acquaintances, some people have fallen ill, and one lady has even died. That was an eye-opener for us. Social cohesion in Heinsberg has become much better. But in the beginning, the whole situation was really bad, because everyone pointed their fingers at us. That time, priest Markus Bruns also witnessed how people from Heinsberg were ostracized. People were insulted, cars were vandalized. Heinsberg bashing became an expression. And that really hurts because nobody is responsible for it in the first place. Even the one who was identified as the first one who was infected. Nobody can be blamed for that. In the meantime, Heinsberg, like all of Germany, is in lockdown again. It has not yet re-emerged as a hotspot, but Markus Bruns knows that corona is far from over.